Community Forums. This is our second forum. We're going to take a break next month, but we'll be back in September. And each month, we're going to highlight a particular topic area that is relevant to most people's health. And you'll have an opportunity after a brief talk by one or two speakers to ask some questions. And the format that we're going to have is, some of you have already got the little pink slips in case you have questions. And during the second speaker, we'll get you, if you have questions, to write them down, and we'll start collecting them. And then I will ask the questions on your behalf, just in case some people are embarrassed or they don't want to really draw attention to themselves. And if I could request that the questions be as clear and specific as possible, which saves me from having to interpret it and ask the wrong question on your behalf, so I just request that. Last month, people had asked that the speaker use a microphone, so we've got Dr. Johnston all wired in for those who can't hear in the back, okay? So my name is Anita Pelso. I'm one of the internal medicine doctors here, and I'll be hosting or moderating these sessions with you. So first I'd like to introduce Dr. Dean Johnston.
And this is a patient that's got a blood clot way out in one of these branches, and these are about the size of a piece of spaghetti or smaller. And the radiologist has managed to get a catheter and snake it all the way up here, through here, until he's right at that clot, and he can actually break up the clot by putting in medication or by putting in one of these fancy devices. Okay, so there's a lot of interesting things that are happening at St. Paul's in terms of why people had a stroke. And so with our new CT scanners, which we've developed, which we've put in place here at St. Paul's, within the last few months, a new CT scanner has been acquired, which can do amazing things in terms of looking at blood vessels and looking at various parts of the brain, and it can be done here.
Busting up those clots that you mentioned earlier.
So TPA can be very effective. It's more effective the earlier it's used. TPA is a drug that we infuse in the vein that helps to break up blood clots. It has to be used within that 3 hours or 4.5 hours now time frame. The problem is human nature being what it is, you tend to use the available time. And so whether the patient presents to the hospital a little bit slower, or we move a little bit slower, or other delays, often patients tend to be treated out towards that 3-hour or even 4.5-hour time frame. And we know that TPA is less effective the later it's used. So that's why I say if you have symptoms, if you have acute stroke symptoms, by all means get in here as quickly as you can and give us the time we need to evaluate you and treat you with that drug if it's appropriate. Not every patient is appropriate to have TPA. It's a risky treatment to use because it breaks up blood clots. It can cause bleeding, and the bleeding can be fatal. So you're balancing risks just like you are with statins. At a different level you are with thrombolytic TPA drugs.